Hi everyone, welcome to this audio podcast. In this audio podcast, as part of this series and around the analysis edition, this audio podcast and around the manuscript Cyclone. This audio podcast in around this analysis edition as part of the Bostic Summit. This is an audio podcast allied to another Storm Robotics production. So in this audio podcast, there will be an overview in regard to works that looks at is there a need or requirement for healthcare scientists educational support surrounding chronic kidney disease CKD and those suffering with chronic kidney disease or CKD. And this is in regards to original research, peer reviewed published works in around 2020 and here, as part of this audio podcast, there will be an overview with some particular and specific updates as well. And so patient access to information support to supplement understanding of laboratory and test parameters, for example, faces challenges owing to medical and scientific terminologies. And such terminology is and can be sort of everyday language for healthcare professionals communicating with each other. But when professionals communicate with patients, the medical terminology can become overwhelming, and such concerns have given rise to provision of requirements in around advice, information, and education around several aspects of health and disease. Healthcare scientists, in this context, who perform laboratory investigations can provide specific education and guidance surrounding laboratory trends and parameters, and when to screen patients for specific disease states and prompt reference for treatment and referral, and thus shift sort of aspects of healthcare sort of from sort of the routine sort of a clinical aspects or a clinical and medical aspects, and through to highlighting aspects around the scientific laboratory and pathology aspects around aspects of healthcare pertinent to those suffering suffering with chronic kidney disease, or those suffering with chronic kidney disease or other sort of related sort of pathologies and regarding pathologies as well. So beyond electronic at the same time beyond electronic patient records, or what's abbreviated in the literature as EPRs, key drivers key drivers or main drivers for new models of care can include number one, greater need for patient-focused services. Two, the need to embrace competitiveness and plurality of provision. Three, a requirement to reprofile the workforce to make it better suited to new sort of modern ways of working. Number four, the need for the definition of core data to create or develop a sort of a framework to emboss efficiency and effectiveness. Number five, recognition in around the core clinical services or laboratory services and pathologies in relation to the impact on patients' journey, leading to requirement for laboratory services, for example, and to be commissioned to be sort of delivered or offered as part of integrating healthcare system or systems. And six, and 6, the need for a leadership aspect in around this. So in this in sort of collaborative works, in collaborative works, investigators seek to sort of explore, highlight perspectives relating to educational support surrounding CKD and laboratory investigations, and sort of the and sort of the in around the healthcare scientist's role from a sample from a sample of those who are service users in around a social media platform referred to and known as the Renal Patient Support Group, or the RPSG. And the research team conducted five specific polls for 6 months between January 2018 and July 2018 to help understand healthcare communication, sort of technology sort of needs and importance of healthcare scientists' educational support for laboratory tests and investigations. The objectives of the polls were to help answer the objectives of the polls, were to help answer the following. Number one, would you see a healthcare professional other than your own physician? Number two, how can health professionals sort of better understand or appreciate being in a chronic illness? Number three, number three was in around healthcare sciences and access in primary care. Number four was in around technology and usage. And number five was in around how likely are you to use the following future technologies for educational support from or involvement with a scientist or with a scientist or a healthcare scientist. So in around this, CKD patients often seek education and or understanding of laboratory tests and investigations to support recommendations surrounding disease pathway. Healthcare scientists such as allied health professionals or AHPs have ability and capacity to extend sort of the knowledge base surrounding diagnostics in and around the diagnostics of laboratory medicine, to provide baseline education of laboratory investigations for those who suffer with CKD. And healthcare scientists have this sort of unique basis to have this sort of unique basis to play. And there is evidence to suggest that a more health promotion in community or part of primary care services can support the understanding of some of the complexities relating to or regarding to laboratory investigations, health and disease. In a mixed methodology, triangulated research works, there was an approach where investigators approach works through three academic institutions or three universities, two health departments and two indigenous organizations, where there was a collaboration to identify workforce capacity in remote communities through the educational aspects. A need was found to educate sort of the educators in around aspects of the chronic care model, and in using a population health approach. One of the challenges was ensuring a clear definitions of providers' roles and expectations regarding shared care. Roles and responsibilities. Defining roles and responsibilities would enhance the positive elements of a collaborative interprofessional care, the positive elements collaborative interprofessional care, and reduce sort of misunderstandings regarding sort of procedures and responsibilities, and in align to authority. So the methods and justifications for the poll polls and service as the polls and sample in around previous investigations, previous investigation had that had been conducted, that had been carried out, that had been carried out. Also inspired the sort of the preliminary investigations through this sort of collaborative works in around CKD patients, identifying aspects of CKD care for those suffering with the disease, and these are investigations. These were the works. Earlier works that had been documented and referred back to and referred into the literature. It was decided between the sort of research team and the social media platform team admin and moderators that 6 months would be enough to gain a sort of a preliminary sort of basis in around answering having service users on the social media platform to help answer these questions. And so ethics consideration for the need consideration, or the need for ethics approval was also made, and the Department of Health guidance was consulted, and ethics approval, or specific ethics approval in around the specific sort of approach around this work was not required in absolute owing to the fact or the basis wherein this works followed sort of the General Data Protection Regulation 2018, a sort of legislation, the General Data Protection Regulation 2018 legislation were followed, and this work also aimed to attain sort of initial perspective from a social media the RPSG social media platform, having understood sort of the remit or the disclaimer around the social media platform. And it was important to get representation from various ethnicities using the RPSG, and the polls were pinned as sort of announcements in the within the social media platform over the planned duration. An initial version of the polls were piloted as well, and amendments were made to questions and phrasing, and potential respondents were informed of the understanding for the poll and the anonymity of the responses, and the ability to withdraw from the polls at any time. And the time frame for the collection of responses to the polls was limited to 6 months only, and therefore a sample calculation at the same time was not carried out. Instead, a target of 1,000 responses was set by the collaborators in this work. 574 service users within the social media platform participated and completed the polls, representing in around just under a 10% response rate. Respondents informed that they would see a health professional other than a physician, and the response was just around 50%. And when asked how health professionals could better understand or appreciate being in a chronic illness, communication was pertinent, where at least only around 33% was the response rate in around this. And when service users were asked if they had access to a healthcare scientist, for example, in around primary care, and would they, if they had access, would they use this service? And the respondents, the service users or the respondents polled in yes in around 77%. A portal allowing another in around another poll, the other poll, a portal in around another the other poll, a poll around a portal allowing access to medical records and laboratory results as well. The service users responded in around 26% on this particular poll, and in around when asked how likely how likely when asked how likely are you how likely are you to how likely are you to use the following sort of future or prospective sort of technologies in around educational support from a healthcare scientist, for example, and in the original research and the works, there was a list of a particular sort of particular responses, particular options where respondents were able to access different responses as part of the poll. Respondents polled highest on access to a remote healthcare scientist through for example a computer or a desktop or an app, so that they can access sort of anywhere. And the response rate was around 33% around this, and so in around this works, the polls that had been carried out added sort of a value to, or at least a basis to an important topic encasing scientists' involvement in provision of education surrounding laboratory investigations and tests for patients who are suffering with CKD. And greater use of skill mix would be important if healthcare is to offer CKD patients sort of more sort of choice. And the aim should be to equip service users with educational educational basis to ensure they have a basis to help inform shared decision making at all levels of healthcare. And at the same time, scientists who have trained to acquire variable skills across practice and across specialties as well could perhaps apply an education basis to support patients in around CKD at primary care level, and this would bring a sort of a much needed sort of professional a professional basis into primary care. And more technology integration could also allow for this, and so and this is where online sort of digital healthcare scientists or online digital scientists or e-clinics with a healthcare scientists amongst other allied health professionals or AHPs could be another proposition where they provide sort of a basic understanding in around test and investigations to prompt sort of shared decision making. So that draws a close and an end to this particular audio podcast in around this this analysis edition. This has been an audio podcast as part of analysis edition as part of the Bostic Summit and part of the a manuscript Cyclone, and as part of another Storm Robotics production. Thank you for tuning in.